Hi, my name is Marissa, and I'm a supervising clinician in the Brooklyn office here at CFA. Today, we are going to be talking about obsessive compulsive disorder and exposure response prevention, more commonly known as exposure therapy. Before jumping into discussing what obsessive compulsive disorder is, I wanted to acknowledge that the term OCD is often misused or used in a derogatory way. I'm sure many of you have heard someone use the term OCD to describe someone else who likes to keep their space neat or clean. The impact of these statements oftentimes leaves those who have OCD feeling misunderstood, invalidated, and stigmatized. Now, let's discuss what OCD really is. OCD features a pattern of unwanted thoughts and fears known as obsessions. These obsessions lead you to engage in repetitive behaviors, which are called compulsions. Oftentimes, these compulsions don't relate to the issue they're actually intended to fix. For example, one may have a fear of their loved ones dying and engage in the compulsion of counting in certain patterns. These repetitive behaviors or mental acts are meant to reduce feelings of anxiety related to your obsessions or prevent something bad from happening. But taking part in these compulsions offers only short-term relief from anxiety, while also reinforcing the belief that sitting with uncertainty just isn't worth the risk. Even if you try to ignore or get rid of these thoughts or urges, they keep coming back, which leads you to act based on the ritual. This is the vicious cycle of OCD. If you have OCD, you may feel ashamed, embarrassed, and stuck, but treatment can be very effective. Cognitive behavioral therapy is based on the idea that how we think and act both affect how we feel. By changing unhelpful patterns of thinking and acting, we can change our emotions. To understand how CBT works, it first helps to acknowledge and understand how anxiety works. Anxiety tends to increase over time because we as human beings learn that avoidance works in reducing our feelings of anxiety, but again, only in the short term. As we continue to avoid triggering our fears, they only grow more powerful and more intense. The goal of CBT is to challenge our urges to avoid the very things that are triggering our anxiety. One of the most important techniques in CBT is exposure and response prevention, exposure therapy. The basic idea is that participants are exposed to the things that trigger their anxiety in structured, slow, incremental steps. As they become accustomed to each of the triggers in turn, the anxiety decreases and they are ready to take on increasingly challenging exposures. The quote, "the only way out is through," rings so true for exposure therapy. So how does exposure therapy work? The first step is identifying your triggers. In a session, we partner to create what's called an exposure hierarchy. The hierarchy identifies specific ways you are willing to challenge your anxiety from the lower levels of a 0 all the way up to the highest level of 100. For example, if you have a fear of elevators, watching a video of someone else in an elevator may be a 0. It might not trigger that much anxiety for you. Standing next to an elevator yourself may be about a 20, but ultimately riding the elevator may be about like an 100. Being willing to challenge your feelings of anxiety and symptoms of OCD is huge, and you should feel so proud of yourself for taking the first step to explore what this could look like for you. That's an exposure in itself. Thank you for taking the time to watch this video, and we look forward to hearing from you here at CFA.